Lifestyle diseases, also sometimes called diseases of longevity or diseases of civilization interchangeably, are defined as diseases linked with the way people live their life. This is commonly caused by alcohol, drug and smoking abuse as well as lack of physical activity and unhealthy eating. Diseases that impact on our lifestyle are heart disease, stroke, obesity and type 2 diabetes. The diseases that appear to the increase in frequency as countries become more industrialized and people live longer. They can include Alzheimer's disease, arthritis, atherosclerosis, asthma, cancer, chronic liver disease or cirrhosis, chronic obstructive pulmonary disease, type 2 diabetes, heart disease, metabolic syndrome, chronic renal failure, osteoporosis, stroke, depression, and obesity. In the UK, the death rate is 4 times higher from respiratory disease caused by an unhealthy lifestyle. Some commenters maintain a distinction between diseases of longevity and diseases of civilization. Certain diseases, such as diabetes, dental caries or asthma appear at greater rates in young populations living in the Western way. Their increased incidence is not related to age, so the terms cannot accurately be used interchangeably for all diseases. Diet and lifestyle are major factors thought to influence susceptibility to many diseases. Drug abuse, tobacco smoking, and alcohol drinking, as well as a lack of or too much exercise may also increase the risk of developing certain diseases, especially later in life. Between 1995 and 2005, 813,000 Australians were hospitalized due to alcohol. In many Western countries, people began to consume more meat, dairy products, vegetable oils, tobacco, sugary foods, Coca-Cola, and alcoholic beverages during the latter half of the 20th century. People also developed sedentary lifestyles and greater rates of obesity. In 2014, 11.2 million Australians were overweight or obese. Rates of colorectal cancer, breast cancer, prostate cancer, endometrial cancer and lung cancer started increasing after this dietary change. People in developing countries, whose diets still depend largely on low-sugar starchy foods with little meat or fat, have lower rates of these cancers. Causes are not just from smoking and alcohol abuse. Adults can develop lifestyle diseases through behavioral factors that impact on them. These can be unemployment, unsafe life, poor social environment, working conditions. Stress and home life can change a person's lifestyle to increase their risk of developing one of these diseases. In 2013, there were 147,678 deaths within Australia, mostly from lifestyle diseases including smoking of tobacco, alcohol use and other drugs. Violence and unhealthy weight have impacted on Australians' death rate. The leading cause of death within Australian males is heart disease with 11,016 deaths, then lung cancer killed 4,995, and chronic pulmonary disease affected 3,572. These were the top 3 major male killers. All these conditions were mainly caused by smoking, alcohol abuse or unhealthy lifestyle. In 2013, coronary heart disease was Australian females' leading cause of death, affecting 8,750 women mainly as a result of their lifestyle. Dementia and Alzheimer's disease affected 7,277 females, and thirdly, cerebrovascular disease killed 6,368 females. These top 3 causes of deaths can be prevented through lifestyle changes within the Australian female and male population. Table shows that ages of people dying and the top 5 disease at which they are dying from.